So at ESMO Congress this year, we presented the biomarker analysis from a conglomerate of several Pembrolizumab studies, both in first, second, and later lines of therapy, looking at the genomic landscape of late-stage gastric and G-junction adenocarcinoma across these studies. As you know, in some of the instances, immunotherapy was combined with chemotherapy or used, pembrolizumab was used alone. What we know about gastric and G-junction adenocarcinoma from the Cancer Genome Atlas is that this is a heterogeneous disease, and particularly for immune checkpoint inhibitor blockade, two subsets make a big difference, including microsatellite instability-high tumors, which comprises from the Cancer Genome Atlas up to 15% to 20% of gastric adenocarcinomas, and Epstein Barr virus positive tumors. The majority of the other cancers are chromosomally unstable, or they have a lot of amplifications and p53 alterations. And then, of course, the fourth subset is genomically stable. So what we did with the biomarker analysis is we wanted to characterize, one, what are the rates of particularly MSI-high tumors in the metastatic setting. And if you remember, a lot of the pembrolizumab studies actually enriched for CPS1 or higher category, and also looked at the genomic differences between and outcomes in PD-L1 and so on between tumors in patients enrolled in the West and in the East in Asian countries, because there's a lot of talk about the difference in biology. And so what interestingly we found in this stage 4 setting is that MSI-high tumors are exceedingly much more rare than was suggested by the TCGA. And that's not surprising, because the TCGA used earlier stage tumors, and we know MSI-high cancers have stage 4 stage better survival, and some of these stage 4 early stage cancers don't ever recur. And then what we also found is that particularly for patients looking at these conglomerate of studies, chromosomally unstable tumors are the most common subsets that are seen in those tumors, which is not surprising. And also that between East and West, there wasn't a lot of differences, at least in these populations, in terms of the tumor biology. So it was an interesting look and perspective on the genomic spectrum of this disease, and particularly the type of patients that are enrolled in these clinical trials.